Chekuri Suvarchala, Scientific Director with Ziva Fertility Centers. What is endometriosis and does it cause infertility? Is there no cure to it? Let's try to understand these few questions. So what is endometriosis? Endometriosis is when tissue is found outside the uterus that appears similar to the lining of the uterus, which is called as the endometrium. Endometriosis may grow on the outside of your uterus, on your ovaries, on your tubes, and even on your bladder or intestines. This tissue can irritate structures that it touches, causing pain and adhesions. The adhesions are like scar tissues on these organs. So how can you tell if you have endometriosis? Many women with endometriosis have pelvic or abdominal pain. You feel like there is a pain in your abdominal area, pain in your stomach, particularly with their menstrual bleeding or when they're trying to have intercourse. Some women have no symptoms. Endometriosis can make it difficult to get pregnant, definitely. In fact, 30% to 50% of infertile women have endometriosis, as in when they walk in and they're diagnosed with infertility, we also inquire to find if they have endometriosis, and about 30 to 50 patients out of 100 give a affirmative for this condition. Sometimes endometriosis can grow inside your ovaries and it can form a cyst. It is called as an endometrioma. This usually can be seen on ultrasound, unlike other endometriotic tissue. So on ultrasound, because we're also assessing the ovaries, we can see this tissue as well. If you have endometriosis, it's through a surgical procedure called laparoscopy. Now, does endometriosis cause infertility? This is a very important question that we need to understand properly. If you have endometriosis, it may be more difficult for you to get pregnant. Up to about 30 to 50%, as I said, of women with endometriosis may experience infertility. Endometriosis can influence fertility in several cases. It can distort the anatomy of the pelvis. It can cause adhesions, it can cause scarred tissue, it can also scar the fallopian tissue. There is inflammation of pelvic structures. There is an altered immune system functioning. There are changes in the hormonal environment of the egg development. There is impaired implantation leading to pregnancy, and there is altered egg quality. So at the time of surgery, your doctor may evaluate the amount, location, the depth of the endometriotic tissue and give you a score. Now this score determines whether your endometriosis is considered minimal, which is called as stage 1, or mild, which is called as stage 2, or moderate, called as stage 3, or severe, which is stage 4. This scoring system correlates with pregnancy success. Women with severe or stage 4 endometriosis, which causes considerable scarring, blocked fallopian tubes, and damaged ovaries, experience the most difficulty to become pregnant and often require advanced fertility treatment. So how is it treated at all? And can it be treated? Endometriosis needs the female hormone estrogen to develop and grow. Birth control pills and other drugs that lower or block estrogen to develop and grow. Birth control pills and other drugs that lower or block estrogen can be effective in improving pain symptoms. For patients who wish to become pregnant, medical therapy may be considered prior to attempts at conception, but this treatment usually does not improve pregnancy rates. If endometriosis is seen at the time of surgery, your doctor will surgically remove the endometriosis and remove the scar tissue as well. This treatment will restore your normal anatomy and will allow your reproductive organs to function more normally. Now, your chances of becoming pregnant are improved after surgical treatment, especially if your endometriosis is in the moderate or severe range. The combination of surgical and medical therapy may be beneficial in patients attempting to conceive through IVF, in vitro fertilization. Overall, treatment is highly individualized for each patient. So it's a very critical matter for your doctor to evaluate, and you follow the instructions given to you by your doctor, especially in terms of treatment, because it is decided by the grade of the stage of endometriosis. If you want to understand more, you've been diagnosed with endometriosis, you have the symptoms, you have been diagnosed, you want to get pregnant, get more information, please feel free to contact us. Thank you. A lot of effort has gone into making this video. Please like and subscribe us. Thank you.